Osteoporosis is a systemic disease of the skeletal system, characterized by a progressive reduction in bone mineral mass and a deterioration of the microarchitecture of bone tissue. The bones thus become more fragile and more subject to fractures, even from minor traumas, in particular the vertebrae, ribs, femur, humerus, and the bones of the wrist and ankle. The reference test for the diagnosis of osteoporosis is bone densitometry or computerized bone mineralometry. This is a radiological test that allows to measure the bone mineral density of the skeleton, that is, the quantity of minerals present in a cubic centimeter of bone, thus becoming a good indicator of the resistance to fractures possessed by the bones. If the result provided by bone densitometry indicates the presence of osteoporosis, it is important to contact a specialist who will be able to indicate the most suitable treatment for each individual. But how is osteoporosis treated? What should be done to keep it from getting worse? Let's go see it. Let's start by saying that osteoporosis is a disease from which it is not possible to recover, but thanks to timely and targeted treatment, it is possible to stop or at least delay the progression of the disease. Physical activity. Physical exercise is considered a real medicine and should be an integral part of a healthy lifestyle at all ages. If you suffer from osteoporosis, you should do more physical activity as it helps to increase bone mineral density, alternating weight-bearing aerobic exercises with strength and resistance exercises. In the first group, we find all those physical activities in which the body weight rests on the bones and which, combined with the force of gravity, helps the deposition of new bone matrix as it stimulates the activity of osteoblasts, cells specialized in the production of bone tissue. Weight-bearing aerobic exercises include walking, jogging, climbing stairs, and dancing. In the group of strength and resistance exercises, however, we find those exercises in which the joints are moved against some type of resistance, whether it's a dumbbell or an elastic band, a machine in the gym, or your own body weight. In this way, during muscle contraction, force is transmitted from the tendons to the bone tissue, thus improving bone mineral density and making the bones stronger and more resistant. These exercises include weightlifting, swimming, and cycling. Experts also recommend performing postural gymnastics exercises as they improve body alignment and balance, thus reducing the risk of falls and therefore also a fracture. For all people suffering from osteoporosis, before starting any physical activity, it is advisable to always contact a specialist who will be able to tell you if what you want to do is suitable for you. Vitamin D. Vitamin D, being a fat-soluble vitamin, is accumulated in the liver and released by the body in small doses when needed. There are two main forms in nature: vitamin D2, also called ergocalciferol, of plant origin, and vitamin D3, also called cholecalciferol, of animal origin. Vitamin D plays a key role in bone health as it promotes the intestinal absorption of calcium and phosphorus, two important minerals that are fixed in the bones, to make them stronger and more resistant. Vitamin D supplementation is essential both for the prevention of osteoporosis in healthy patients and in osteoporotic and osteopenic subjects, particularly in the elderly. Vitamin D intervenes on the metabolism of calcium at blood and bone level, increasing bone mineral density and reducing bone turnover, that is, that physiological process of bone renewal in which older bone tissue is removed to be replaced with other younger tissue. The Italian National Institute of Health reminds that to treat osteoporosis, it is advisable to maintain normal calcium and vitamin D levels, making changes to your diet if necessary, and taking supplements. The choice of drug to use, dosages, and methods of administration must be prescribed by the attending physician. 80–90% of vitamin D is mainly synthesized by our body following exposure of the skin to UVB sun rays, and to a lesser extent, 10–20% through food. Among the foods that contain vitamin D, we find fatty fish, such as salmon, sardines, herring, and mackerel. Mushrooms, in particular porcini, chanterelles, honey mushrooms, and champignons, but also egg yolks, cod liver oil, and some industrially manufactured foods, such as milk, to which vitamin D is added during production. Medicines. Among the main drugs administered to treat osteoporosis, we find bisphosphonates, a class of medicines capable of inhibiting the action of osteoclasts, cells of the bone tissue responsible for bone resorption. Bisphosphonates can be administered orally, intramuscularly, and intravenously, depending on the therapeutic principle used, and are taken on a weekly or monthly basis. Bisphosphonates are the most used anti-resorptive drugs for the treatment of osteoporosis and have been shown to reduce the risk of all osteoporotic fractures, vertebral, femoral, and wrist, and to increase bone mineral density by inhibiting bone resorption. Like all drugs, bisphosphonates also have some side effects, the intensity of which varies from person to person and depends both on the active ingredient administered and on the sensitivity of each individual towards the drug used. Among the main side effects, we find flu-type symptoms characterized by fever, fatigue, and osteomuscular pain, as well as nausea, diarrhea, and abdominal pain. In rare cases, bisphosphonates taken by mouth can cause irritation and inflammation of the lining of the esophagus and stomach. For this reason, patients are advised to keep their torso in an upright position for at least 30 minutes after taking the drug in order to reduce the permanence of the drug at the esophageal cardiac level and therefore the time available for these agents to irritate the gastrointestinal tract. Among the other side effects that can occur following the intake of bisphosphonates, we find vision abnormalities and ocular disorders such as conjunctivitis, uveitis, and scleritis, as well as renal failure and transient hypocalcemia. Before starting any treatment with bisphosphonate drugs, it is important to always consult a specialist in order to receive correct therapy and careful monitoring of the response to treatment. Among the other drugs used to treat osteoporosis, we find anabolic drugs such as teriparatide, capable of stimulating bone formation by acting on osteoblasts. Finally, we find hormone replacement therapy based on male or female hormones, monoclonal antibodies such as denosumab, and selective modulators of estrogenic receptors or SERMs such as raloxifene. The treatment protocol for osteoporosis is therefore based on improving the patient's lifestyle, preventing fractures, on their treatment if they occur, and on the use of supplements and drugs to strengthen the bones. The type of treatment will depend on the results of the tests prescribed by the doctor and his assessment of the extent of the risk based on a series of factors such as age, gender, and bone densitometry results.